Now, we have been discussing matters to do with meno. Personally, we gave our stories here. How your situation was, how yours was. You lost your milk teeth. Mine was extracted. Yours was very painful. Daktari, can you do it when someone is expectant? In the event that you have other conditions, how do you go about it? You know, because we've also seen several situations in the country where many have gone to get their teeth worked on, and many have lost their lives. What's the connection? You know, is the tooth closer to the heart? That's the question. What's the relation? You know what I mean? Yeah. And to have that discussion with us is Dr. Akali Leslie, who is a council member and chairperson, KDA Advocacy. Karibu sana. And he shall be joined by Dr. Sarah Wanza, who is a dentist and a member of KDA as well. Karibu sana, Daktari.
Thank you so much for having me.
Kenya's biggest conversation, eh?
Yes. So thank you so much for having me.
Yes.
My name is Dr. Akali Leslie. I am a dentist. I am the KDA council member and also the chairperson of the KDA Advocacy Committee. So thank you so much for having us. This is actually a very important conversation for us to have this time around. I don't know if you are aware, but today is actually World Dentists Day.
World Dentist Day. Oh, yes, we celebrate you.
Yes.
We give you your flowers.
Thank you.
Celebrate the teeth.
And we are actually having our World Oral Health Month. And we have our World Oral Health Day on the 20th of every March every year. So this is a very important conversation, and thank you so much for having me in studio.
Karibu. Yes. Now, before we get to that conversation, lazima tukupe job. Hapo ukiingia ni kazi, situation room, hot seat, kazi lazima ipigwe. So let's talk about a country called CAR. So we visited CAR this weekend. We came back with a proverb. But a little something about CAR is its population is around 6 million people. And as you talk about the population in the country, you also look at how it is being described. And it is said to be the poorest, one of the poorest countries in the continent. But that notwithstanding, they are rich in resources: diamond, gold, uranium. So one asks the question, with all these resources, why poor? Perhaps something needs to be done, right?
Yes.
But let's go to the proverb. An elephant does not limp when walking in thorns. How would you interpret it?
An elephant
does not limp when walking on thorns. Don't overthink it.
I shouldn't overthink
Don't overthink it at all.
No,
There is no
I'm a man of
extraction.
science.
There is no extraction.
There are no
like
extractions here. So
you can extract the thorn from the elephant, but it still would not care.
Yeah. I think what we look at, the elephant would maybe describe or is a metaphor for big things, right? So once we have small things that are really disturbing us, the magnitude of whatever we're dealing with is insignificant. That's how I'd like to look at it. So when we are dealing with a greater issue, a greater cause, the insignificant disturbances really don't or shouldn't get in the way, right, of what you are trying to achieve. That's how I look at it.
Yeah, Dr. Sarah is here. Karibu sana to Kenya's biggest conversation. And we just want to throw you straight into the deep end. So we are here interpreting proverbs. We are in CAR, a beautiful country, around 6 million people. But the proverb that we get is, an elephant does not limp when walking on thorns. An elephant does not limp when walking on thorns. How would you interpret it? What do you think they're trying to say?
Come again?
An elephant does not limp when walking on thorns. Don't overthink it. But your interpretation is never wrong.
Is it about balance?
Go.
Maybe focus on where they're headed to. Yeah.
That would be it. Yeah.
Focus and balance. Yeah.
Yeah, because you see, at the end of the day, when you talk about focus and balance, right? So it's a question of, if you have thick skin, regardless of what comes your way, you're still focused on where you're going. You're looking at your goal, your vision, and kelele kidogo hapa kule does not bother you much. So yes, you're right, and your interpretation is never wrong. But let's dive into it.
Okay.
Tooth extraction, kungoa meno.
Yes.
That's how it's called, eh? Many have said that it is a procedure, first of all. What you've seen rather in the recent past is that we've had cases of individuals who walk into a dentist, an extraction is done, and unfortunately, many have died.
Yes.
One asks the question, Why? How is that correlated to death? Because one would say, jino tu mtu anakufa kwa nini? What would be the reasons why we are seeing this? Will you go first, Dr.
So we'll start by saying extraction in itself is not the problem. And mostly for the cases that have been highlighted in the media, it's been a case of infection. Infection that probably was there before the extraction, then got worse after the extraction, and intervention measures didn't kick in good time. The other way someone can die from an extraction is if there is uncontrolled bleeding, excessive bleeding for that. And that is why people go through a screening. Like by the time a dentist is deciding to go ahead with an extraction, there are things they will have noted. Maybe sometimes delay the extraction or take care of the systemic problem before, like a case of high blood pressure. If someone is hypertensive, chances are the dentist will not start that extraction until the blood pressure is gotten to control. But mostly what's been highlighted is infection. Infection getting worse and not getting intercepted in good time.
Dr. Leslie, is there a situation where, as a settle, I've come to you, I have a bad tooth, perhaps it needs to go, but you will say, based off ABCD, I'm unable to extract it? Because there are those who also come like, daktari inanisumbua, toa, usipotoa mintavuta na plies. At what point do you get to tell someone no?
So, thank you for that question. When we talk about tooth extractions, right, there's a criteria for it. Do you qualify for that extraction? So, as Dr. Wanza has aptly put it, number one, do you have any systemic illness, right? So, I do what we call history taking, right? I ask you some specific leading questions. Do you have uncontrolled diabetes? So, if I figure out, if I pick that out in what you tell me, I'm like, okay, hold on, I cannot do this extraction now. Right? Are you under any systemic medication? If you're on blood thinners, like, okay, Oseto, you cannot do that extraction now. I need to get approval from my other colleague, right? Are you epileptic? Right? Okay, if you're epileptic, are you under medication? Can I get the approval from your primary doctor? Right? Are you having uncontrolled hypertension? Right? So those are some of the instances I can say no. And also, if you have a very big infection, right? So if you have a huge infection that I know won't work with the local anesthesia, I'm like, okay, let's put you on medication first. Let the infection die down a bit. Then we can do the extraction, right? As Dr. Wanzas put it, an extraction is not an issue, right? It's not, let me be politically correct, it's not the cause of death, right? In most of these cases, it's actually the infections that happen. So those are some of the instances. If you have epilepsy, systemic conditions, if you're undergoing some form of radiotherapy, right? So those are the indications that will make me as a dentist to say no.
Hold on. I have a friend of mine who, every time he gets back home, at least twice in a week, he has to buy his children sugarcane. And the vendor is the same person, so same vendor. So, and I know this because I asked, kwa nini kila siku, kila mara tukiwa pamoja, you have to buy this sugarcane? So he had this long story of, my children and their tooth, when they are brushing, it's painful, the gums, etc. So I'm trying to do my bit as a father to harden, So when is tooth extraction necessary?
Okay, so I'll take that, then Dr. Wanza can also take it.
Yes.
Right? So tooth extractions are necessary, one, when you have something called pulpitis. Pulpitis is pain, right? So if there is pain, too much pain, that is an indication of, an extraction. And that, not necessarily an extraction. Once you visit the dentist, if the dentist has a look at the tooth in question and it cannot be saved, right? So there is no resolve for it, that's a good indication for an extraction, right? If you have an infection affecting one of the teeth, right? So this tooth cannot be saved, it has a massive infection, and you weigh the benefits and rewards of treating the tooth and saving it, right? There are instances where you have periodontal disease. This is gum disease. People tell you, my teeth are weak, they're always shaking. So you cannot be able to eat, you cannot be able to talk well, right? So what is the benefit versus risk of putting it there? Maybe Dr. Anza can continue.
And she comes in, perhaps, because tooth extraction, in my opinion, ought to be the last resort.
Yeah.
Yes.
It is.
Dental care needs to be like very focused.
Yes.
For people to know before I go to the dentist, before the infection grows to warrant an extraction, what are the things I need to be doing? Is it feeding my sons and daughters sugarcane? Or, is it having roast maize? Is it brushing twice a day or after every meal? Like dental care. Some do you have you do what, like filling, before extraction. So in terms of, and a dentist once told me that if you, and I don't know whether this is a myth, I like it when professionals are here, they demystify that if you do take care of your dental system, regardless of your age, you should die with all your teeth.
Yes.
I don't know whether that is true.
100%.
If that is so then where do we fall short as humans in terms of dental care now to warrant extraction, infections that even are leading to death? I think we have a case that is not more than 2 weeks ago where a pregnant lady, both her and the unborn child, they perished from an extraction. Where do we fall short?
I like the redirection to dental care that is proactive, not reactive. And the issue about the sugar cane, highly encouraged. Tell your friend to continue doing that. Because the hard foods have their role in actually developing a child's jaw structure. So a big problem we have in matters teeth is that diet has changed over time. Evolution of diet. Foods are ultra processed, which actually raise the risk for the most prevalent dental problem, which is cavities. And a cavity is what will eventually lead now to the cascade that leads to infection that can even spread downwards or even upwards. So dental care is the very best place to start. And starts with education. You do not wait until you're in trouble to go seek dental care. It should be like a part of because again, the mouth does not exist in isolation. It's a part of a whole system. We say that the mouth is a window to the body in multiple matters, whereby by taking care of that, you're taking care of yourself fully. So definitely dental care is where to start. The cases we've seen in the media have definitely been cases of seeking treatment as a reactive measure. I mean, this pain that doesn't seem to go away, so you go to get treatment. And in some of them, it was actually established that the care wasn't sought at a proper oral health care practitioner. And definitely dental care is where to start. You see your dentist, we say twice a year?
Minimum,
Twice a year. I like to say don't let a year pass by. Just go for that checkup. Because right now, even as a dentist, the 5 of us here, if we get a checkup, there is some form of inflammation, infection in our mouth. But the thing about the mouth is that it's forgiving. Teeth are very forgiving. It's like a friend. They're very good friends who never get angry. They take it in, until one day they explode. And that's teeth. Teeth are like that. Infection can stay in your mouth for years and years, but there's always a breaking point. And what we're seeing in the media, eventually leading to death, is that breaking point.
So, you speak on something that is very critical, and that goes squarely to our health-seeking behavior. Because we live in a country where today I will only go to hospital after I have treated my headache for 3 months. Then I'm like, hey, this thing is not going away. Let me go where and see a physician. Yet, the very first instant when you had this headache, that was the best time for you to go, be told exactly what it is you're dealing with. When you talk about your teeth, I can smile, Hayumi, it comes and goes, so why bother? I see I have plaque, but I can still eat. Life is normal, right?
Yes.
And then you're being told, but you have a tooth problem. YouTube, we also told to Google our symptoms, never to Google our systems. But that's exactly what we do, right?
Yes,
so you're being told you use sea salt here, some warm water here, gargle, eat sugar cane, it is a brush, it will get away. You know what I mean? But you never really get to walk to a dentist to tell you exactly what it is you're dealing with. Generally, our health-seeking behavior is wrong, because even if I come to you and I still have diabetes that has not been found, I would still be walking into a death trap, because you'll be dealing with something that I do not know. So kindly speak to the need for all of us to see a dentist twice a year, and what that would do in ensuring that our oral health and general well-being is good.
So let me just walk us back a bit, right? The theme for our World Oral Health Day this year is a happy mouth is a happy life, right? And the mouth is the gateway to your body, right? So I don't know how many of us have kids here, right? But in the event that you do, right? When did you take your child to the dentist?
When they were in pain.
Yeah. You see,
6 months actually.
Yeah. So ideally, you need to establish what we call a dental home, right? Which means your child needs to visit the dentist before they turn 1, right? By 1, there's maybe 1, 2, 3 teeth in the mouth, right? So there are things that the dentist can pick up early, right? That can inform how we move forward. So to speak to that issue of health-seeking behavior, as Dr. Anza has aptly put it, dental problems are silent, right? They take time to manifest for it to actually bother you. So I usually tell this joke to my patients. Basically, everyone will tell you, oh, my gums bleed, right? And they're like, oh, me when I brush. But let's say if your hand was cut and it just continues bleeding, would you stay home? No, right? The thing is, how important do we take our oral health, right? It's the gateway to your mouth. It's the gateway to your body, right? So the first thing is dental treatments. Our dental problems are usually very silent, right? And when they start very silent, and the treatment in terms of cost is usually very small in the beginning.
What is the cost, by the way?
Yeah, the cost of dental treatment, that varies, right? But our public facilities are actually well equipped to handle some of these cases, right? So the cost of treatment is cheaper when it's caught early, and the only way you catch it early is by visiting your dentist, right? In a public institution, I can be corrected if I'm wrong, but opening a file is 200 shillings, right? So once
if Shah is working, but carry on.
Yes, right? If Shah is working, it's 200 shillings. That is a conversation for another.
That's for another day. Come on.
Right? But 200 shillings to open a file and just say, hey, I need to see the dentist, right? In most private facilities, I think it ranges from 1,000 to 2,000, right? So if you just say, okay, you know what? Let me just spend 1,000 to go and see the dentist so that I can have a picture of what's going on, right? So look at it in terms of cost. It's easier to visit your dentist at least once a year, right? To know what you're dealing with, what you can prevent. Because, and just to add on, dental and the mouth changes so rapidly, right? Why do we say 6 months? Your body, your skin now and in September, it's going to be something totally different.
Something new.
Your cells have changed, and that's what happens to your mouth. It is rapidly changing. Right? How our solution to this is that we really, the Kenya Dental Association is really trying to integrate oral health education into schools, right? We have so many dentists who are using the public platforms like Dr. Anza to educate, right, the importance of visiting the dentist, because it's a culture thing, right? The same way you were taught to shower fasting in the morning, we need to inculcate that to our kids, that you need to brush at least twice a day.
Dr. I'm going to throw these to all of you. You had a question.
I was shooting and not sharp.
Shoot.
to the teeth keepers.
Yes.
Like you mentioned, Dr. The evolution has happened. The kind of foods we eat, how we live our lifestyle, how we maintain the dental hygiene. Before, back in the days, we would use twigs and these trees, which would serve purpose of like being medicinal, and then clean your teeth. Today we use mouthwash, toothpaste, whatever it is out there, and quality is both questionable and wanting. I don't know. Sometimes you see they say dentists authorized or qualified. You'd see some toothpaste where you say they've been like commissioned by the dentist fraternity.
Association, yeah.
You can use them. And others, they don't meet that, but they're still in the market. So like for a person like myself, a consumer of such products, where do I start looking on what to use when just for simple maintenance, I don't have a condition yet, I'm just trying to do my basic hygiene and dental care. And number two is for the young ones. Transitioning from milk teeth to the grown-up teeth becomes a challenge. If you realize sometimes because of the foods you're talking about, maybe the kids have been overdoing sugar, starch, and then the oral hygiene is not well maintained. They start having gum problems, and then the whole dental formula is messed up. What would be the do-it-yourself as a parent for the young ones who are still learning how to just do basic maintenance, or they're depending on you as a grown-up to help them, so they do not now start using the mouthwashes without mentioning brands? How do we manage the whole ecosystem of doing things at home and acquiring products that really we need to use efficiently for the dental care vis-a-vis the food?
Okay. Should I go first? Yeah. So basically, what you can do at home, right? As soon as the first tooth is in the mouth, I don't care if it's just that tiny bit, oral care begins, right? That means even if it means by using a cloth, okay? You have to clean that tooth. That's your responsibility. Two, I usually educate my patients, right? And usually try and educate the public that brushing should always be assisted for a child. I know we like our children being independent. He or she can brush the teeth by themselves, but they do not have the dexterity.
Jaden can do it.
Yes. Right? It should always be assisted, right? So it's okay, your child can put the toothbrush in the mouth, but are they actually brushing, or are they just passing it around? So you have a go at it. It's an interactive process that involves the parent. It's not enough to just buy the toothbrush and the toothpaste. Be present. Do it. Right? And after you are done doing it, let them have a go at it. Right? So that's where you need to start. And in terms of toothpaste, you just need to start with a simple fluoridated toothpaste. Right? That is if you've not visited your dentist, right? And you're saying, I just want to take care of my teeth. A simple fluoridated toothpaste. But also visit the dentist, let them have a look, and then they can recommend what is best for you. Maybe Dr. Anza has some.
Yes, on the food, the feeding, and the effect.
Dental care, the foundation is toothbrushing. And every time a client asks me about which toothpaste to use, I always throw it back to the toothbrush. Toothbrushing is a very mechanical situation. What matters is the brush you have, can it really get in there and come up with the dirt? Okay? Very, very mechanical. Now, when it comes to the toothpaste, sometimes I tell my clients that as long as it has fluoride and you pick for your age recommendation, like let's say your child is this toothpaste 0 to 2, 3 to, you're okay, whichever. It can be any brand. But as long as it has that, it's adequate, as long as the mechanical aspect is well taken care of. And that is where we talk about now, on top of just brushing, try your very best to floss. Always make sure you clean your tongue right after. And the very, very big part, actually, of oral health that we don't give attention to is water. Rinse your mouth after that glass of juice. That helps you way more than waiting till evening to brush with your very fancy toothpaste.
Yeah, or electric
Rinse
toothbrush.
with water. In the morning when you wake up, water. Like I tell kids, water is your friend. It's a joke in my practice. Water is your friend. Your other friend is you don't ever go to bed without brushing. Even if you're sleepy, get the brush, put it in your mouth, and with your eyes closed, because it's mechanical. You're removing. And then the other thing that I've added in like the basics, kabisa, is sorry.
No, it's fine.
Is breathing.
Breathing, like
A lot of problems we're seeing with children. Let me take it. I'm a children's person. a big thing of what we are treating in children currently, ranging from teeth malalignment, multiple cavities, a 7-year-old with very bad breath, yet they brush, is an issue of breathing through the mouth. We are not meant to breathe through the mouth. And that is now another thing that I've added in the basics. Because those 3 things anybody can do. You can make sure you brush before you go to bed. You can go the extra mile and floss and tongue scrape. You have water within your vicinity almost all the time. And you can try your very best to breathe through the nose. And when it's difficult, like when we have ENT issues, we direct you to an ENT specialist. In fact, pediatricians, dentists, and ENT people need to start working together now, because it's a personal assessment, but yes, I think it's a pandemic.
Why are we not allowed to breathe through our mouth? Because one would say, in the event that, say, I have a cold and all that, it makes sense. It's the next course of action. I'm just going to use my mouth, But now, just bring us to par as to why, despite the mechanical things, I have a fancy electric thing I imported because I was told it does well. I still have a bad breath. Why would that be the case?
Breathing through the mouth dries up your mouth. It gets it robs you of your protective mechanism in the mouth, because your protective mechanism is your saliva. The mouth is let me take a tooth an example. We are at constant, minerals are lost, then they are brought back into the tooth through saliva. Saliva is what is now making all that happen. What we call remineralizing teeth, demineralizing whenever you have your glass of juice and your mouth is acidic. Your saliva plays that role. When you're breathing through the mouth, there's a dryness. So you don't have that protective aspect with you. Now, we are supposed to breathe through the nose, children especially. Okay, adults as well. But through the nose, the air you're taking in is filtered. It's made warm. And you're not going to get those benefits when you're breathing through the mouth, which is why you may see a child who constantly gets a cold. It's like it never disappears. When you pay attention, that child probably sleeps with the mouth wide open. Yes. And that is something to pay attention to.
Interesting.
If we get anything today from me is, let's pay attention to how the children are breathing. At any given time, you look at 5 kids together, you will notice 3 of them, the lips are just apart. So it's like the mouth breathing is a default. It shouldn't be like that.
So,
and talking about children, and as parents, I believe that's something to really take note of, right? And then to act on, so that the way you normally say, okay, ukitaka kulala we enda tulale. So it's therefore important to just check that they are sleeping. But when you are children, madaktari, now that we have 2 madaktaris here, there used to be this saying that so there was an over-concentration of removal of the lower teeth, and that if you remove any of your upper tooth, then you would go blind. I don't know whether there is any medical background to that, or is just a myth.
I think that is one of the most publicized myths, right? Dentists are trained to maintain your teeth for as long as possible, right? Because even the baby teeth, what they do, they guide the permanent teeth into eruption, right? So one of the habits we used to see, or let me call them myths, is that they needed to extract a certain tooth when a child's around 7, 8, because there are a lot of changes happening, right? A lot of changes happening. So when that happens, right, you're actually destroying that child's habit. And let me just throw some statistics into the mix, right? We have at least 46% of children, right, suffering from dental caries, 46%. And then you have, this is as per our oral health survey, we have around 40 or 41% struggling with dental fluorosis, right? And I know everyone here has had a story about the teeth turning brown in Naivasha, in Ngong, right? And 9 out of 10 adults have gum disease. 9 out of 10, right? So some of these myths are usually rooted in culture, but so far we've done a good job in eradicating them, right? And just to echo what Dr. Wanza said about our habits, that mouth breathing, it's actually a very big challenge, right? Because it's a developmental issue. What happens is when you do not breathe through your nose, right? You're restricting your jaw bones from growing adequately, right? So, and part of it I usually attribute it to the sedentary lifestyle that we have currently, right? The children are on their iPads, they're on their tablets, so they're in a very relaxed state, and that brings out that, that habit. But always circle back to visit a dentist, right? At least once a year. And how do you do that? You're visiting a qualified dentist, right? Currently, you can visit a practitioner and ask them for their name, right? Take that name. P, if there's anything for me actually that you take from me today, is verify that you're being seen by an actual dentist. What you can do is take their name, P # their name, and send it to 20547. Right?
Say that again.
P.
P like letter P.
Letter P.
Okay. Police.
Yes.
Okay.
P #, and there are 2 names. I am Dr. Akali Leslie. Send that number to 20547, and it will tell you, this is my board registration number, and I am a registered dentist. Right? So you as the public, you have ascertained that you're being seen by a dental profession.
So you send it as a message?
Yes. P #, you can use my 2 names as an example. Akali, Leslie, and you send it to 20547. Yeah.
Wow. So then when it comes to the transition, I'm avoiding sounding like a doctor because I'm not one. Kids will lose teeth naturally. At what point do you force the tooth out? We say, is it shaking? Keep shaking, or do you leave it until to a point where they feel themselves chewing it with the ugali? Because that's where sometimes I feel you may remove it a bit too early, or wait too late until there is it an overgrowth or whatever, that another one will start growing to a different direction. So how do we manage that? And then he spoke about alignment of teeth. There is an uptake of dentures
Braces.
now. Braces. How do you reconcile the two? Managing from the transition and then the managing on the realignment of the teeth.
The best case scenario is that tooth falling off on its own without you needing the dentist. And for some kids, that's still happening. But then again, because of the jaw development, because evolution-wise, something is happening, because suddenly children just have smaller jaws than the teeth can fit. And in that case, you may notice that you're getting teeth crooked at at 6 years. You can actually see a child whose teeth, like the permanent teeth, are already starting to grow on the inside. So there are some cases where you actually need to seek dental care to get those teeth extracted. And not just to get the teeth extracted, to get an examination done to determine, are we having this problem because there's a limitation in space? And if we have a limitation in space, where is that coming from? Is it an issue of jaw growth? Is there a way, as your dentist, we can nudge the jaw growth a certain way? Because we have those treatment modalities. And about braces being very rampant, first of all, there's nothing like fashion braces. And braces need to come in when they are necessary. But before braces come in, when a child is 12 and below, they have growth potential. They're their jaws are moldable. So there are appliances that can be used to guide growth. There are exercises that children can start doing to start working in their favor, matters growth of their jaws. And ultimately that helps either avoid braces or get braces as a way of just refining what is there, which is another best case scenario. Yes.
Yep. I want to look at the kind of life that we live nowadays, right? So you clearly said that even in terms of jaw development, there's clearly a difference that can be experienced from what you see, right? Mm-hmm. So here's a question where, how do I, as a parent, notice that? Okay, fine, I'll need to come to you,
yes.
right, to notice that, right? But then what is causing it? Do you have that information so that parents could also know? Mm-hmm. Perhaps maybe it's the sedentary lifestyle, PS and playing, being on tablet the entire day. Is it in terms of the kind of foods that we're eating nowadays? We are consuming a lot of processed food.
Yes.
What could be the cause as to why we're seeing changes in our jaw development, something that is foreign to who we are as a people?
I like to say it's, first of all, evolution of food.
Okay.
Because we're giving our children very soft foods. So the jaws are not doing the workout they need to do to grow adequately. Another issue is, and this is, Daktari knows that I like to do those, just trying to get deep into it. Immunity issues. Like, children are more susceptible to some viral infections that end up causing their adenoids to inflame, and that now robs them of the airway. So they have to now resort to the mouth. When you resort to the mouth, breathing through the mouth causes the jaw constriction. Small jaws, teeth don't fit. We start to see the overlapping.
Okay.
So what I usually have is, I give parents red flags to watch out for. And the very first red flag is the mouth open at rest. That's a red flag. You get it checked. Another red flag would be early malalignments. Your child is 6, 7, and their teeth don't even meet. There's what we call an open bite or clear teeth overlapping. We have, maybe your child can barely lift their tongue up, their tongue is really constricted to the floor of the mouth. That is also something a parent can check.
A tongue tie?
So technically, yes, a tongue tie. So technically, it would help if there were images to show a parent, this is the red flag, this is the red flag. And once you see the red flag, you come into the dentist. And it's also okay to normalize second opinions, because I have seen children who've been told they have to wait until they're 14 to get braces. And this is a child who started struggling from age 7. So that is a number of years of struggle with infections that don't seem to clear, with esteem issues, because children are laughing at each other at school a lot also. So early intervention. And I think sometimes we remain in a bubble and forget that not everybody has access to the premium dental care that Daktari and I will be offering, or even access to a proper public facility that has a practitioner who can point these things out. So,
just to echo that, we are facing, I would call it a systemic failure.
Yeah,
right?
We do have that.
We have 60 million Kenyans, right? And dentists have not even clocked 2,000 since 1960, right? So we've lost dentists who've sadly passed on, and even including them in our rota, we are not yet to 2,000, right?
Today?
Yes, today. There are less than 2,000.
Including those who've passed on.
Yes, because you have our registration numbers, right? So we are less than 2,000, right? We only have 2 dental schools in the whole country.
Wow.
Okay. A dental school.
But we have more than 2,000 dental clinics in the country.
Well, now that is a conversation for another, right? Because we're having we exist in a system that has complementary cadres, right? But everyone has their scope of practice, right? So you can have dental clinics or dental facilities, but 1, are they registered? 2, who is manning them? And 3, are they sticking to their scope of practice, right? All of us are supposed to work together. So what we are seeing basically is a systemic failure. We're having few dentists, we're having few facilities that can see, especially even in public hospitals. There's a dentist, but there's also a limit to what they can do. because of the resources.
Yeah.
So everything has to change, and I would just put the task on the national government to recognize oral health as an important thing, because if 9 out of 10 Kenyans face a problem, that's an alarm, right? Because if you have a tooth problem, you'll not show up to work, you'll be in pain, you'll not be productive, right? And that's why even countries like Japan have an 80-20, or is it 80-28 rule, that by the time you're 80, you need to have at least 28 teeth in your mouth, right? So all of that impact on the workforce, and I would just ask the national government to just put oral health as one of its top priorities.
What are the do's and don'ts when it comes to taking care of your health? Because everyone out here has information. Others will tell you use apple cider vinegar together with the baking soda. It will make your teeth white. Others use banana peels, rub it on your teeth. It will make it work. What are the do's and don'ts when it comes to taking care of your teeth?
Okay, the question is quite triggering for me, right? Because I'm always fighting online, right? With the purveyors of this information, right? Who is giving you the information? Let's just start there, right? About what are the do's and don'ts. First of all, when you see material, who is giving you this information? Is it a registered dentist or a dental practitioner? Is just someone on TikTok or Instagram with 1 million followers?
I tell you, it's AI.
Yeah. No, at least AI has some level of truth to it, right? So what are the do's? Bare minimum: brush, mechanical, brush and floss twice a day. Bare minimum. Visit your dentist 2 times a year at the least, right? I think that is the baseline everyone can start from, right? Because after that, what we usually do, dentists, we are trained to give you a treatment plan. We tell you this is our primary objective, let's handle this, and then we move to this. So that first visit goes a long way in creating a plan to make sure you have a good oral health plan or oral hygiene, right? So those are the bare minimums. Maybe Doc can add.
Doc, how do we brush our teeth?
Is it this way? Is it this
Small circular motions. Small circular overlapping motions. And the brush bristles need to meet the gum line at a 45-degree angle.
I know.
I know that's a lot.
Yeah.
Okay, actually, before I go to the technique again, he mentioned 2 bare minimums. Let me add my 2.
Yes.
Water. Make sure that child is rinsing with water after, and keep repeating it to them until it becomes a part of them. And breathing through the nose. Bare minimums. And how you start encouraging it in children is friendly reminders. Let's zip the lips and breathe through the nose. Because the moment a child closes their lips, the tongue automatically elevates. And the tongue is participating a lot in their growth. So just quick reminders. Lips together. That's it. And then water after meals. Now, how to brush.
And before you go to the how to brush, because I've also heard that when you're rinsing, you should not use salty water. So I have, again, a friend who buys this water from the vendor in heavy containers. And it's like, this is not for drinking, it's for brushing. Because the assumption, or whether myth or truth, is that when you use the salty water while brushing, it weakens the teeth.
I think the idea, salty water, I think what is being referred to as salty water is water with excess fluoride. Because I feel like what you're building to is that salty water is causing brittled teeth or teeth that are discoloring brown.
Correct.
It's not salty water.
Okay.
It's the water that has high levels of fluoride. Mostly borehole water. Every estate right now, the pride of estates is borehole water. But our children are paying with their teeth. And remember, dental fluorosis is what we can see. There's skeletal fluorosis. And there's also some effects to the brain with excess fluoride. So definitely something to pay attention to. And it's for both drinking and cooking water. Yes. Yeah.
Asante Sarah. In terms of brushing the teeth, I think if you could just quickly to just go through just real quick here.
Say where do we find you? As you say how to brush. Where will people find you? Where can people find you?
Okay. So how to brush? Brush bristles 45 degrees, like angulated towards the gum line. Because the gum line is not smooth. There's a depression there. That's where that hides. So you need to meet 45 degrees angle. Small circular motions, overlapping, small circular motions. Avoid this.
Okay.
This is bypassing a lot of dirt, and this is also causing mechanical damage to your teeth. Because I know we like to do this. But on the biting surfaces, though, you can do that.
Okay.
Yes.
I think we're running out of time. The conversation is sweet, eh?
Yeah.
Because it's a minute na jonta wow up and Evelyn, right? So we're going to be sharing your contacts with individuals, right? So that they can reach you directly. So check our social media. Check our social media as well as check our social media as we continue to post this conversation moving forward. Dr. real quick.
I would want one parting shot, right?
Yes.
I would like to just invite the public. We are having our World Oral Health Day walk happening on the 21st of March at Ulinzi Stadium, Ulinzi Grounds. It's an avenue for you to get your teeth checked at no cost. Come with your families, come with your spouses, come with your friends. We're having a walk to commemorate the World Oral Health Day, right? And my parting shot is make sure you're seen by a qualified dentist. Tooth extractions are not the problem, right? And yes, let's just take care of our oral health.
Dr. real quick, in 30 seconds.
Yes, so clearly people are afraid now of dental extractions. He said they're not the problem, which means also an infection in your mouth that has not been addressed can also take the same pathway and actually lead to that massive infection that is life-threatening.
If you need to take care of your tooth, it is a daily occurrence. It's not a one-time show. You know, when you wake up, whatever you drink, make sure water is your friend. When you're brushing, small circular motions at a 45-degree angle and overlapping each other. Important. My name is Dennis Asedo. I've been here with Dr. Akali Leslie, who is a council member and chairperson KDA Advocacy, and Dr. Sarah Wanzam, who's a dentist and member of KDA as well, Joe Kamanya, Asante Sana, and Kevin Osido. This is Kenya's biggest conversation at exactly 3 minutes after 10. Good morning.
This is the Situation Room, the only way to start your day.